Okay, so it's 8:30 and welcome everyone, and I'll call this meeting to order, November 22nd. And before we do anything else, I'm going to give our CAO, Mr. Hogan, a chance to introduce our new director. So if you would, please.
Thank you, Deputy Reeve King. It's my pleasure to introduce Kinza Barney to our team and welcome her to her first official meeting with Council, I guess here at Committee of the Whole. So Kinza has come to us from Northern Alberta, and we're excited that she's on the ground now and starting to learn about the county and to tie into the business that we do. So if everyone could join me in welcoming Kinza to our team.
Yeah.
Welcome, Kinza.
We're very glad to have you. Yeah. Okay, thank you and welcome. So we have an agenda in front of us. Are there any additions to the agenda? Okay, seeing none. Reeve Whitstock?
I'll move the agenda as presented.
Okay, so we have a motion to approve the agenda as presented. All those in favor? And that's carried. Thank you. And then attached are the minutes from the October 18th C.O.W meeting. Any errors, omissions, corrections? Seeing none. Councillor Christie?
I'll move the minutes as presented.
Okay, so we have a motion to accept the October 18th Committee of the Whole minutes as presented. All those in favor? That's carried unanimous. Thank you. All right. We are now on to Three Hills Water East. Welcome, Mr. McKernan. Good morning, John. Whenever you're ready.
All right, thank you. Good morning. All right. So this morning I bring forward a discussion on the Three Hills Water resident engagement. Kneehill County Council has reviewed the options to provide water service to the residents to the east of Three Hills that are currently not serviced by the Mount Vernon water system, and will proceed with town hall type meeting to engage with these residents and landowners. The service area for the potential water system has been established in prior meetings, and this is where we have taken the people from. A study has been undertaken by a third-party consultant to establish several ways to service these residents within the specified area and the estimated cost for the different options. A prior survey of the residents within designated was also completed, and the results were provided to council. So some of our discussion options are a couple of potential locations for this town hall meeting could take place at either the Mount Vernon Community Hall or the Three Hills Community Center. The Mount Vernon Community Hall is readily available for rental, whereas the Three Hills Community Center has prior bookings because of the gymnastics club. And I see that I actually have a little typo there. It's actually Tuesdays and Thursdays that they are booked, not Tuesdays and Wednesdays. Sorry about that. So resident and landowner commitment has been determined to be a driver for this project to proceed to the next level, which would be more detailed engineering. As this is an important driver of the project, administration will mail out invitation letters to all residents and landowners within the specific area to attend this meeting. The invitation letters will include an attached short 3-question survey that can be mailed in to provide an opportunity for a resident to provide input, even if they are unavailable to attend in person. A QR code will also be included with the invitation so the residents can respond electronically. Our hope is that with these additional options that we'll be able to hear back from as many landowners or residents as we can. Beyond the invitations being sent, administration will also use social media and our webpage to advertise this town hall meeting. Administration will present a short PowerPoint presentation, briefly discussing related information on the background, project scope, proposed water service area, and the financial commitment. After the short presentation, administration will be available for questions and discussions. So some of our outcomes for this discussion is just to basically approve the information that we presented in your package as per the PowerPoint, the invitation letter, the proposed Three Hills 3-question survey, as well as maybe select a date, time, and venue for this town hall.
Okay, so are there questions, comment? Counselor Forbes?
Why Tuesdays and Thursdays?
We can't do it on Tuesdays and Thursdays.
No,
just
no, why are you choosing, does it matter what day of the week we do it?
No, that's totally up to you guys. I was
Oh,
just saying
okay.
that's when they're booked, so if you're thinking a Tuesday and Thursday, we can't do it in Three Hills. That's all, yeah, just some information that. And we can look that up, actually, the availability for the Three Hills Community Center is actually online, and you can actually go in there, pick a date, and you can actually see if it's already booked or not. So if we need to go that far, we can.
Okay, any other question, comment? Counselor Cunningham?
This actually might be more of a question for Councillor McGee, but is there an opportunity to hold it at Orkney at all, at the hall there?
I would think there would be, yeah.
That would be an option too, maybe.
The reason I couldn't confirm the numbers for Orkney for capacity. So we're inviting all the landowners, that's hundreds of people. And if they all did attend for some reason, I don't think Orkney would, but I don't know, I can't confirm their capacity, sorry.
I can't remember, it is over 100, but
Is
it'd
it?
be crowded, yeah.
Yeah.
Okay, so any other
I've never been.
questions or comment? Is the material provided? What we were looking for? Are we happy with what's there? Do you want to walk us through what you're actually going to present, John? It sounds like maybe there's some interest in that happening.
Sure. See if I can figure it out.
Counselor Penner?
John, Mount Vernon Hall, that's the little one out in the country, not the church, Mount Vernon Hall, correct?
That's the hall just off of Highway 27.
Yeah.
Yeah.
Okay, because it's not very big. Orkney Hall is bigger than it, but,
Orkney would
Oh.
be twice the size.
Oh, okay. Is
Yeah.
it twice the size?
At
Okay,
least,
because
yeah.
when I phoned Mount Vernon, they said their capacity was over 100 and stuff, so I
Yeah,
thought it would be
no,
sufficient.
we're quite a bit bigger than they are.
Yeah.
Yeah.
Well, like I said, it's open. I mean, just because those two are listed doesn't mean those are the only two. You could go
No.
to Acme. and
right, no, and for sure, I love using the halls that we support are within our county. So I'm all for using the ones in
Yep.
out in the rural area.
So you maybe should ask for standing room only numbers or with seats or, because it does vary quite widely depending on what approach we're taking, so.
So we'll start off with basically the PowerPoint slides. So our first slide would be the background. So just some short bulletin points on where we've kind of come from. So starting out with the interest. So the interest has been there for the people to construct this system for a while. In 2021, we did that survey where we asked for participation to get some, just get the gauge of the interest. Then we went on to, after that survey, we went on to some high-level engineering to basically determine some costs and some options to provide that water. And from there now, we're on to the open house to engage with the residents and see what their commitment and desire are still. The next one is just kind of the project scope, so just some quick bulletins about what this project will entail. So basically what we decided was a water system with a full flow service, water pump house, as well as a 24/7 bulk water capability, a dedicated feed line from either the town of Three Hills or the Aqua 7 Regional Commission. The water service area has been identified, and it falls between the Highway 583 in the north and Three Hills Creek in the Three Hills Creek in the south, and the area east of the Three Hills, bordered by the east there by the Red Deer River. And also then just basically the location of the pump house and the station have not been determined yet, so that'll be more beyond when we start getting into more of the engineering and things like that. Our next slide is the proposed water service area. So this is the area that we have identified to potentially serve with this area. So yeah, I think it is our intention to also have this up on a big board as well at the town hall meeting, so that it's visible not just on the PowerPoint but to everybody. Our next slide then would also then be starting into the financial commitment. The proposal of a $20,000 connection fee or we put the 10% of the cost just because things can change when we actually do get these numbers in. And like I said, again, costs are based on the high-level engineering received, so what we've already done, this is what these numbers are based off. So anything that you see financial is based off high-level engineering, and things can still change throughout this. And I guess I say that in the next point. And then the county, what we were looking at from our discussions earlier in a different meeting, in a prior meeting, is the 80% commitment from the residents on this project. Our next slide goes a little further into the financial commitment, and this, again, is based off of the high-level engineering. So these costs are, like I said, they're not set in stone or anything like that. So we kind of took some of the financial information and put in some of our costs. So we can kind of go through those. Basically, for a full water system or a standalone bulk station, that's our proposed capital costs. And then how much the connection fees paid by the ratepayers. So this is how much we collect from our ratepayers is 1.7 million. Our county capital cost, and then the county capital cost per connection is 209,000. So that's just a little formula. So that's basically showing us what the county's paying for these users to have this water system.
So just before you go past that point, so at our meeting, we're sort of looking for that 80% commitment level, but these costs are calculated on 100% of the 85 residents, right?
Yeah, that'd be basically all residents basically.
So that
connected.
connection fees paid by ratepayers would, that 1.7 would be 85 residents at the 20,000.
Sorry?
So that, where you say connection fees paid by ratepayers is 1.7 million?
Right, that's the 85, yes.
That's 85 at
Yeah,
20.
that's correct, yeah.
Okay, thank you.
So that can change based on the scope, right? Because now we're also inviting all the landowners here. And if, let's say, some of the Bear Quarter decides they want it, then that's not included in that 85. It could now become 89. Like, so it's, these numbers are very fluid, right? Depending on what really happens. Right? So this is just basically with the 85 people that we had for the connections. That's the numbers that you get. So it's just a static number for those amount of people, but it can obviously move around. And then our funding sources. So there's got the reserve, the debt, then it goes into what we have for a dam limit that's utilized and what we're currently utilized and what this debt would do. So then your total debt after this project completion. So this is just showing where the county will kind of basically end up after we fund this project through debt and things like that. So.
Councillor Christie.
At this point, there's no grants, both provincially and federally, that you're aware of that are available?
So no, not that we are aware of because of the style of project. I mean, things may change, I don't know, but right now we're not connecting to basically a hamlet or some other kind of populated area, then we may be able to get grants, but if we're just going to farmhouses and stuff, I haven't seen a grant yet available.
Reeve Whitstock.
So in this funding sources, there's no place in here for water service area tax? Like we haven't calculated anything in there?
No, not that I'm aware of, but that might be a better question asked for maybe.
So through the
Mr.
chair,
Zier?
the intent with this public meeting is to garner, or to gauge the support of the project. From there, as it said a few times through you'll see in the future letter, here we come. Once we get an overall view of the support of this project, then we will look at the funding sources of it. We have investigated the grants, verified through Alberta Transportation that they aren't eligible for any sort of grants through their programs currently, because it is Water for Life or Alberta Municipal Water Wastewater Program. Both are primarily for urban areas or connection to urban areas. So rural connections aren't funded under that. So basically the point of this meeting will be to see the response from the residents, hopefully get the support through it, and then from that point we do have the numbers worked out for what the debt borrowing would be, but the fine details of that are afterwards on this. So.
Okay, Reeve Whitstock.
Okay, thanks, Mike. Thanks, John. I have one other question. When I look at the water service, the proposed water service area, until we get some engineering not final, but better engineering, we won't even know if we'll be able to provide water to each and every residence. Is that correct? Or are you confident that there is an availability ability to connect each and every residence in that area.
I think that the system would probably be engineered to service those people. Now, there may be people at different elevations that may get different pressures and flows or something like that, but I think that if we have the people, then I think they can engineer to it. Depends on what needs to be done, right? I mean, maybe depending on elevations, maybe there's lift stations, you know, booster pumps, that sort of thing, so.
Yeah, that's into the future here, so. Yeah, I just thought I'd ask right now, but that's fine, thank you.
So the question I would have is, so we're saying it's an 80% of the 85, technically is what we're looking for right now. So let's say we have 70 people come in and say they're interested. That would then trigger the process to move forward. So the question that if I'm a resident out there and I'm going to ask at this meeting is, so 70 of my neighbors say yes and I'm a no. When the system goes in, is it mandatory to take a connection?
Then I would say, Reeve Whitstock would.
We've had that
That would be a
conversation,
discussion.
right, where we've said that we would expect that everyone's taking a connection.
right.
So that's information that we're going to be providing those people, that they need to know that even if 70 of you say yes and 15 of you say no, that's going to trigger us to move forward to get the high or the in-depth now engineering, costing, all those things in place. And then that means we're going to go back to them at some point in time to say now instead of 20,000, it's 25 based on the new engineering and the actual final costs. And everybody needs to understand they're going to be connected at that point. Am I correct? Or am I wrong? And I guess I'm asking council and administration that question.
That's how all our other water service areas are. Everyone that's in that area that was able to get that water service provided was required to ante up,
Take a riser.
take a riser. And I don't think there was any place that anybody was missed because of elevations or even the end of the line. It was still done. So I think to stay with the policy that we had prior to, I think it would probably be a good idea to remain with that policy.
Mr. Hogan.
Through you, Mr. Chair, just to follow up on what Reeve Whitstock said, is I was going to echo those same comments, is that where council's approached this in the past is that those risers would be mandatory. That is, of course, a philosophical question for council. But as Reeve Whitstock said, that's what you have done in the past. And we'd anticipate that that would be the same going forward, although council could alter that. If you do choose to alter that, though, then you might find if there's not a large uptake on those risers, the numbers change.
Well, and I guess my whole point was not so much a debate about whether that's what we would do or not, but that's what we're going to clearly communicate, is that's an expectation. If this project goes forward, if you're a resident there, you will be receiving a riser. Whether you are hooked to that riser or not is your choice, but you will be paying a riser fee. And so I think we need to be very clear in our communication exactly what the expectations are. And so that's really was why I was raising that issue.
Okay. Yeah, we can definitely add that in one of the slides in the PowerPoint to make it there.
I think it's important that we're clear what our expectations are going to be, and that we help people to understand that even though they might not be really enthusiastic about this project, if there's enough and we go ahead with the engineering and then as council we decide that we're going to do this project, then that's going to be an expectation.
Yeah, we can definitely add that if that's what the wish is.
Councillor McGee?
Thanks for bringing that up. I think it's very important, and I think having a slide is excellent, but John, it should be in the initial letter.
In the letter as well?
It has to be. We have to be very clear on that letter exactly the scope of what people are coming to look at.
Okay.
That's going to make a huge difference.
May increase attendance.
Oh, yeah. Phone calls, too. I think we might have to take a hiatus.
Well, Councillor Christie.
I'll just, the other part of that is that if we've had a water service area tax, it has to be in there too, I think. Because that's part of the cost that was implemented on the last water system, so the precedent's there and the cost is there, so we gotta get funded somehow.
I think we've been made pretty clear it wouldn't be necessarily a water service area tax, but it'd be a levy of some type that's attached to that. Mr. Hogan?
Through you, Mr. Chair, I think one of the things that we could look at it's tough to outline a lot of that stuff in the letter in a way that's clear and makes sense. But I think during the town hall, we could definitely put some emphasis on, we did have slides prior to this around what a resident could expect for their monthly or yearly utility bills. I'd suggest that we stay away from that in specifics, but we could use that as an opportunity to talk about what things it might look like. Because if that's a levy that you're applying that could hit their tax bill, if that's an additional flat fee that you put on the water bills, right now the county has the philosophy that we charge the same for our water systems, with the only exception, well, I should say the exception being whether that's a system or groundwater. We do have a difference in rates for those, as well as a commercial rate for bulk water. There's nothing saying that has to continue in the future. You could recoup this through some sort of, well, you wouldn't recoup this entirely, but you could accomplish some of the same thing by making the monthly flat rate higher for this system than other places. As a way of doing that, as we said before, there's a few different ways in the funding and how this occurs. You know, we could maybe talk about those things broadly to let individuals know that they would be looking at a monthly utility bill. But how you fund this would ultimately be a future question of council. Whether you took some from reserves, whether you took debt, whether there was a local improvement levy, whether there was additional charges applied to utility billings, they're all options on the table for you. And I think it's too early the residents should know that those are all options, but it's way too early to specifically state this is how it'll be without knowing the overall numbers or those discussions.
Thank you. I think it's important that it not be a 14-page letter, for sure, because then no one's going to read it. The key communication here is that it's critical that they participate in the conversation. And I know the phone calls I've had from that area, that's my number one message is it's up to you and your neighbors to be involved. And so for the residents in that area, this meeting is critical for us to gauge their interest and their willingness to either participate or not. And our move forward will be very much dependent on what we hear. I think that's very, very important, so. But I think that in that meeting, we need to be prepared to share with them the potential of what it's going to look like for them if we choose to go ahead with this project, and if the interest is there, exactly what's the expectation with a little bit of wiggle room in terms of what we're going to look at. I think we need to share that at that meeting. Any other comments or questions? Reeve Woodstock.
I guess I'm just gonna do a little math here, and from what I can tell, if you're using 85 residents and our capital cost is estimated at that 19 million, we're looking at about $230,000 per riser. I know it's showing the capital cost, but that would be with the $1.7 million out with that 210,000. So I know when we did the other water systems, we were pretty much in around that 60s to 65 per riser. So this is considerably more than what we were at in our other water systems.
Yeah, and that's true, but I think that the amount, just when we did these 15 years ago and stuff, the actual cost of them was a lot lower. You know, this is direction of drilling, whereas before we got that spider plow. So there's a lot of different things that have probably contributed to a little bit higher cost for
Oh, no, by all means. I'm not, spider plow worked really well. We don't have the availability to do that now, so it is going to be considerably more expensive. But it is considerably more expensive at $230,000 per riser.
Yes.
So I'm going to perhaps suggest looking at the clock and realizing that we have a delegation at 9. I'm going to suggest maybe we just table this now till later in our meeting, and we'll pick it back up, the conversation. That will allow our presenters on the primary care network to get ready. And John, if you don't mind, I'm sorry, we're going to make you wait. We appreciate your being here and presenting, but if you don't mind, we'll take a little break here and come back to you.
For sure.
Okay. So Welcome. Just making sure we're okay? Okay, we're good. So before you get started and introduce yourselves, we'll introduce ourselves and as council, and then you'll know approximately who you're talking to, and we'll go from there. So we also have our CAO and our directors in the room, and of course, Carolyn, who keeps us on pace and going where we need to go. So Laura Lee, if you want to be the first to introduce yourself.
Good morning, Laura Michelle Cunningham, Division 5.
Carrie Phobes, Division 4.
Wade Christie, Division 6, so I'm in the northwest corner.
Ken King, I'm Division 7, that's the northeast corner.
Jerry Whitstock, I'm the Acme Linden area, Division 3.
Faye McGee, Division 1, so near around the Carbon to Drumheller area.
Good morning, Debbie Penna, Division 2, Swalwell South.
So welcome. I guess we'll get you to introduce yourselves, and maybe I should, you directors, you might as well tell them who you are as well. So Kevin, if you want to be first.
Mike Hogan, Chief Administrative Officer.
There, now you know who we all are, and we're looking forward to meeting you. So if you would, please take your time and make your presentation. Oh, sorry. The mic needs to be on because we are videoing and broadcasting. So it need a red light on it. Just push the button down. There you go. Now you're on.
Good morning, everyone. I'm Tammy McCubbing. I'm the Executive Director for Big Country Primary Care Network.
Okay.
Good morning. My name is Tara Tulikoff, and I'm a registered nurse that works over at the Kneehill Medical Clinic.
Okay.
And good morning. My name is Tim Schellenberg, and I'm the mental health counselor here at the Kneehill Clinic, and then also at Drumheller at the Drumheller Associated Physicians and the Riverside Clinic.
Well, welcome.
So we're just going to go through a short presentation this morning. If you have any questions as we go through, don't hesitate to stop us and ask for clarification. And then we have some time at the end for questions or anything that may come up during the presentation. So we sent out our vision and mission. So our vision is your health, your team. And our mission is we're committed to a multidisciplinary model of delivery, quality, and comprehensive primary health care services where patients experience improved healthcare access and outcomes, and where health professionals experience increased collaboration, efficiency, sustainability in their working environments. So it's a mouthful. Essentially, we try to increase access and quality healthcare services. You'll see we have a big geographical area. So we started the PCN April 1st, 2008. And you see we cover the east and south areas of Central Zone. So Stettler, Castor, Coronation, Consort, Three Hills, Hanna, and Drumheller. And our joint venture partners are with Alberta Health Services. The next slide is just a picture of our population by numbers. So population within our geographical area, and again, it's always a moving target, but it's approximately 48,500. And our panel patients, and we'll talk about what that means in the next few slides, is about 38,458. And that changes again as physicians come, as physicians go, and as patients change who their family physician are. We have 47 physicians in our nonprofit organization. We have 10 clinics, and then I've just listed the board members, and I guess the key thing to that is we have great representation across our whole geographical area. So most of our communities have a physician on our board that represents their community. And then we've listed our AHS governance members. Many of you will be familiar with Barb Frere. She's been on our board Joint Governance Council for many, many years, and is quite familiar with Three Hills area, Drumheller. And Barb Melhorn just joined our Joint Governance Committee probably less than a year ago, and so she's just learning the different areas. It was new to her. She took a new position. And then our PCN employees, if we combined everyone, we have a FTE of 25.2, and then we have a 0.8 executive director, myself, and then a 1.0 administrative coordinator who couldn't come today, but she holds that position. I wanted to talk, the council had asked about our governance structure and our finances. And so I want to talk a little bit about our funding model. So we are funded through a capitation-based model, and the PCNs are joint ventures between Alberta Health Services and our local primary care physicians, but we're actually funded by Alberta Health, which is different than Alberta Health Services. We acquire funding by developing a business plan that describes programs that physicians will put in place to improve local services. And so again, you do a 3-year business plan and submit it for approval to Alberta Health every 3 years. And we just finished the cycle, so we have an approved business plan until 2025. And then we use most of our funding to hire interdisciplinary teams of nurses, social workers, mental health therapists, wellness coordinators, and other health professionals to deliver services to the patients we serve.
So just before you go past that, you said you're joint venture and funded by Alberta Health. So does the clinic help fund, or is the funding completely through Alberta Health?
The funding's completely through Alberta Health. The clinics do support us in giving us space, as well as we couldn't run without, the physicians are the nonprofit corporation.
Right.
So we couldn't run without physician support. So when our physician numbers drop, so does our funding, because with less physicians, we have less paneled patients, and we receive $62 per paneled patient annually.
Okay, so the requirement of the clinic is to provide you with this space, and then,
Yes.
of course, the doctors and the patients are calculated into your funding number.
Yes.
Okay, thank
So
you.
we receive numbers twice a year from Alberta Health. And if we go to the next slide, it explains how they, it's called the 4-cut method. And so how they panel a patient to a physician is based on these 4 concepts. So the first cut is patients who have seen only one provider in the past year. So if you've seen Dr. Smith and you've only seen Dr. Smith, you're paneled to Dr. Smith. The second one is if patients have seen multiple providers, but one provider the majority of the time in the past year, by Alberta Health's methodology, you're paneled to that physician. So a patient who's seen 2 or more providers equally in the past year, but no majority provider can be seen. So I've seen Dr. Smith twice, I've seen Dr. Joe twice, then whoever did the last physical that's who's paneled to that physician. And then patients who've seen multiple providers, they are assigned to the last provider seen. So it's quite a complex way that they assign a patient to a physician. And then once they're paneled that way, they're paneled for 6 months until we get new numbers. So for us, our struggle always has been with funding is that it's a moving target. So we base our annual budget on 48,000 paneled patients, and then we have 3 physicians leave and our panel drops, so our funding drops. And we still want to carry our services out, so we have to be creative sometimes to make that work. Any questions about the funding? Because that was key information you wanted.
Councilor Christie.
So the discrepancy between the 48.5 and the 38.5 is people that just don't see anybody.
That's right. They're not paneled to a family physician, so they may go to a walk-in clinic. They may just not have received health care. They're young, healthy, haven't had a need for a primary health care physician, so they may not have went to the doctor. Or in some communities, haven't been able to find a family physician because there's no one accepting patients.
There's no records of anybody that's going outside the area.
We don't have, there is definitely people that go outside our geographical area, I do not have access to those numbers to tell me how many people are out migrating, they call it. We have asked for Alberta Health to try to track that because that's important to us. But to date, we haven't received those numbers. And a lot of communities don't have many physicians accepting patients any longer because their practices are full.
Thank you.
The next slide just talks a little bit about our governance structure when it comes to Central Zone. So Central Zone PCN Committee identifies and responds to primary health care and population health needs in Central Zone in collaboration with Big Country. So all the PCNs, there's 12 PCNs in Central Zone, and all of those PCNs, we get together as a committee and discuss health needs and initiatives that we want to move forward within our geographical areas. So the committee formalizes shared responsibility and commitments of PCNs and AHS to provide services, and they focus on collaboration and integration opportunities to improve patient outcomes, enhance patient experience, and support sustainable costs. So you'll see on the next slide, we do a lot of planning and a lot of alignment together as a team. And one of the big things, and we talk about it a lot in our world, is duplication of services. So if I'm offering foot care in the primary care network and AHS is offering foot care in Alberta Health Services, how do we optimize that so we're not doing duplication of services and confusing patients? Because the healthcare system's complex enough. We don't need to increase its complexity. So you'll see that we have zone stakeholders agree to address population health needs through common goals, priorities, and then evaluation. And zone stakeholders work together to respond to needs of individuals and population to deliver comprehensive services and continuity of care across settings and organizations. And zone stakeholders collaborate to ensure health system resources are collectively addressed and leveraged in the most effective and efficient way. I would say I've been with the PCN 5 years, and I would say over the last 3 years, we've really done a great job at being more inclusive. We're starting to train staff collectively. We're really coming together as a zone to optimize education, initiatives, and moving provincial structures forward. Next slide. So again, we work closely with external community agencies, Alberta Health Services, and physician groups to ensure duplication of services is avoided. And we talk a lot about, it's not that we can't offer the same services, because we offer different levels. For instance, with mental health, Alberta Health Services have counselors as well as we do, but we have a tiered system that allows us to offer short-term counseling. They offer more long-term counseling. So we have a lot of conversations about what that might look like and how do we optimize the resources we have. So I'm going to talk a little bit about our initiatives next. So primary health care is the first place people go for healthcare and wellness advice and programs, non-emergent treatment of a health issue, and to diagnose and manage any health conditions they may have. So we have 3 initiatives in this business plan, and I'm going to walk through each one. But patient medical home, chronic disease management and complex care, and mental health and addictions is our 3 initiatives until 2025. So we're going to walk through each one and talk about what's in them. So our patient medical home, we include patient referral navigators, some funding for evening clinics, and then prenatal nurses. So our patient referral navigators coordinate referrals to specialty care. So if you go to your physician and ask to be seeing a neurologist, they facilitate that referral, making sure it doesn't fall through the cracks somewhere between the physician making the referral and the specialty clinic receiving the referral. They coordinate investigations that have been ordered by your primary care physician, and then they provide information about the primary care network and Alberta Health Services programs. So basically, if you need to know anything about being referred somewhere, they're a specialist in it. And they are very knowledgeable about wait times, where can you be sent, for instance, an orthopedic referral. They can tell you how long the wait times are and where you're going to get the most expedited service for what you're looking for. Our low-risk prenatal program. So our registered nurses and teams support family physicians in the delivery of prenatal and postnatal care for low-risk maternities. So family physicians provide a shared care maternity service for low-risk maternity patients, and our registered nurses, and in some cases licensed practical nurses, provide an excellent resource and support to the mom and babe. And then we deliver babies in numerous areas throughout our PCN and in the hospitals. Our next initiative is chronic disease management, and it includes registered nurses, licensed practical nurses, nurse practitioners, foot care, and wellness coordinators. So our registered nurses and licensed practical nurses work in collaboration with our family physician teams to improve patient outcomes, care coordination, continuum of care, and information sharing. You can see there's a list of things that they address. A lot of it is chronic disease management. And in certain areas, they do specialty areas, like for instance, Drumheller offers geriatric nurse who has a liaison with the community to offer a community day program, some caregiver support groups. So we are looking at ways to bring that to each community, but resources are tight, of course, as they are everywhere. So, but we are looking at ways, because it's been so successful in some communities, that we're trying to expand it throughout the PCN. Nurse practitioners, of course, you do have a nurse practitioner here in Three Hills and 2 in Drumheller, and they work collaboratively within the family practice to enhance delivery of primary care services. We receive patients and provide health services based on high demand and developing nursing knowledge and skills. They conduct comprehensive assessments, health conditions, treat and manage acute and chronic illness. They order, interpret, and screen for diagnostic tests, and they provide chronic disease management and initiate any investigations necessary. So our foot care nurses, this initiative was designed to address the high risk population in the family physician practices for nail care. And I know it sounds simple, but it is such a huge need when you have foot issues and you have nowhere to go to get support for them. So this has been a well sought after initiative that often has wait lists because it's full. Now our wellness coordinators can help people increase their level of regular physical activity, and they really look at health promotion and wellness. We also offer a GLAD program, which is certified therapist-led exercise sessions targeting for osteoarthritis. So anybody waiting for a knee or hip replacement finds huge benefit in this class. And then they offer the Excel program, which is exercise for cancer patients to enhance living well. And then our mental health and addictions, it consists of mental health counselors in a remote social working position. So our mental health providers can offer a variety of mental health services. We do offer short-term counseling, so it's a little bit of a gray area, but we offer up to 6 appointments of counseling. And if that person's coming to an end, rather than switch to a long-term practitioner, we will offer a few more, as opposed to saying, no, you need to start fresh with someone new. So it's a little bit of a gray area, but our intent is to offer that short-term immediate counseling versus someone with a chronic condition that might need lifelong counseling. That's more Alberta Health Services-led programs. And then we do offer support to physicians with continuing professional development, as well as our own PCN staff. And this is on an annual basis. They have to apply. It's a very minimal part of our funding, but I just mentioned it because it is important that we support our physicians and staff to continue their education. And that is it for our initiatives and services. So I'll open the floor up to any questions that you might have.
So are there any questions? Counselor Cunningham.
Hi. So when you spoke about the out-migrating of patients, so if we have someone that lives in this area and they are, like, have a physician outside, are they still able to access the services here?
So, yes and no. So it's always been hard because what the PCN prides themselves on is that continuity of care. And so if say they're doctoring in Strathmore and they come here to access Tara as our registered nurse or our mental health counselor, Tim, the EMRs do not talk, the electronic medical records. So their record in Strathmore wouldn't be able to see what our staff have done to advance their health, and that's problematic. So we say, it's not a hard, fast rule, but if you doctor in Strathmore, you probably should seek your PCN services in Strathmore. But there's no hard, fast rule. If you don't have the money to commute, it is something we consider, but it is problematic because it doesn't allow for that open communication with their health record.
Go ahead, Counselor Cunningham.
So with the EMR, is that being replaced by the Connect Care, or is that something?
No.
No, okay.
So Connect Care is an Alberta Health Services-based program, not a clinic-based program. And keep in mind, clinics are private businesses, so they can have any electronic medical record they choose. So even from clinic to clinic, they don't have the same medical records. And even if they did, like in our geographical area, we have 2 electronic medical records. So most of them are running the same electronic medical records, but they don't talk from clinic to clinic. They aren't that advanced, which is a downfall, right?
Any other questions? I guess I would have one. So Tara, you're a nurse in the clinic there.
Yeah.
Are you the nurse practitioner, or is that an additional position?
That's an additional position. So nurse practitioners and our registered nurses are 2 separate positions.
Okay.
And we have there's 3 registered nurses and licensed practical nurses at the Kneehill Clinic. And that goes for many of our clinics have multiple registered nurses or licensed practical nurses, depending on how many physicians they have and their paneled patient base. So I should mention, Big Country PCN's a little bit unique from some of the other PCNs, that we don't have a standalone clinic. So what this has allowed us to do by embedding staff in the physician's clinic, it has allowed us to put the majority of our money towards actual frontline staff, as opposed to paying a lot for a facility building, rent. So it has afforded us the benefit of hiring a lot more frontline staff by saving money on not having a standalone building.
So when you say that, do you contribute then towards part of the facility cost in the Kneehill Clinic, or not really?
We contribute a small amount for office supplies. And again, it's based on number of staff we have, number of physicians. We do supply a small amount, but it is nowhere near what we would pay for rent, insurance, et cetera, somewhere else.
Okay, any other questions? Counselor Cunningham.
I just wanted to say, I was able to work a little bit with Tara as an RN. We were on a committee together, an elder abuse committee, and so I really like the fact that you folks are involved in the community. When you said like building healthier communities, I think that's really neat to see that collaborative approach. So thanks for what you do.
And we're really happy that you reached out, because we are trying to get the word out there about the primary care networks. Because we are embedded in the physician clinics, a lot of patients see us as clinic staff, right? They don't, even though we wear name tags, they don't differentiate that we're primary care network versus clinic staff. So often when people are asked about the primary care network, even if they've sought services in the primary care network, they maybe don't recognize that it's separate funding, separate disciplines.
Okay. Any other questions? Counselor Penner.
Not necessarily a question, but just, healthcare has become confusing. Like, I think way back, there was 2 streams of nurses, I believe, that you went for 2-year or 4-year, or however it went. Sorry, I'm not in the medical field, but And I think that's the biggest thing now is educating people that, on like, what's a practical nurse, what's a registered nurse, we don't know that if you're not in the field or if you haven't been exposed to it, right? If you have a healthy life. And I think the whole medical system is confusing. So I think an education program needs to happen more that, do you know that the primary care network does this or so, you know what I mean? It's just very confusing to me, because I don't use it very often, touch wood, I don't have to use it soon, but, you know, that's just a.
We have done some community outreach in the past. We actually attended, I want to say 2 or 3 years ago, we did a lot of trade shows and fall fairs and to do a PCN blitz to say, did you know? And that's when we found out most patients, even if they've seen Tara or Tim, they didn't recognize that they weren't clinic staff. So we have tried to do over the years some more promotion about what is the PCN, and we will continue to do that. But again, anything we do outside of offering direct patient care takes away from direct patient care. So it's a balance.
So if we could just go back to the nurse practitioner for a second. So sometimes nurse practitioners fill the gaps because there's patients on attached to physicians. Do those numbers get counted in your paneled patients?
They do. Our nurse practitioners have their own panel patients, and so they're calculated just like the physicians.
Okay. Thank you. Any other questions? Councillor Penner, sorry.
That's okay. Going forward, Connect Care is supposed to connect us all. Can you see the EMR and Connect Care, like, being one, so that everyone knows it's, or you don't think it will ever happen, one system?
Well, I'm not the guru on Connect Care because I don't work for AHS, but there is a community, so AHS has adopted Connect Care. There is a community package, but it sounds like it's many, many years out. So it may happen. If I had a crystal ball, I would have that answer, but I don't. And it may happen. The capabilities in the future will be there, but for now, no.
Okay, go ahead, Councillor
And I
Penner.
guess, and I fully understand that it's going to take a little while for our different facilities to get onto Connect Care because it's a private business and they have their own system. So I can see that taking a little while too, or not necessarily. You might have a 3 to 4 year contract with them. So I guess that'll be the first step, if we can get everybody on that, you know, at all our clinics. And then from there on, hopefully.
It would be a wonderful thing if it happens. It really would, to be able to have that continuity of communication. Now, family physicians do have the ability to Connect Care from their offices, but their actual electronic medical record and Connect Care don't communicate. Right? I'm getting it right? So.
And I bring this up because I don't doctor locally. There was no doctor available, so we went off. So, but it would be nice if I have to go to the hospital here, you know, or a quick visit to an outpatient, that you know all my records from my doctor from out of the area.
Yes.
So is there a cost to the Connect Care?
When it comes to the community setting, I'm sure there will be, because there's the EMRs are quite costly for physicians. I think you'd be shocked. I don't have the exact numbers, but it is extremely expensive, any of the EMRs they run, partly because of the privacy. They have to have extraordinary firewalls to protect people's records. And it's a business for profit, right, the EMRs. So they are quite costly, and I'm sure there will be a cost to Connect Care that's comparable to the EMRs they run now.
Which is probably part of the reluctance of a physician to have both an in-office electronic record and then this overarching.
Yeah. So my understanding is way in the future, when Connect Care becomes available to the community offices, that it would replace their EMR, but don't quote me on that because, like I said, it's not my program.
There's a lot of complications involved.
There's a lot of complications. So I'm not a Connect Care expert. I don't work for AHS. I haven't been trained in it, so I'm kind of talking with what I've heard, not necessarily what I know.
Yeah, in a way, we're talking public health here and private business, because each of those doctors is really a business person outside of that big public health system, so.
Yes.
Okay, any other questions? Councillor Cunningham?
Yeah, I was just gonna mention, I do have a relative that is working in Connect Care right now, and I think it's been a long process just to get to where they're at now. So I think hopefully down the line, it will come to something like the clinic, but I think it's gonna take a few years just to get where they're at right now kind of figured out. So hopefully, future.
Councillor Christie?
My question, the doctors have hospital privileges, work both in the clinic and the hospital. The support staff they have in the clinic, does it have any time in the hospital, or you just work in the clinic?
So we just work in the clinics. In some communities, for instance, if I took foot care, if there was a very complicated case in long-term care, couldn't afford private foot care, we will bridge that gap and go in and basically service that specific patient. But predominantly, we don't do any work within AHS. And sometimes we'll assist in long-term care of the lodge in certain communities. But basically, we're in the clinic in primary health care. We don't bridge that gap into acute care. We do some, like, our nurses are very well versed in diabetes. And so at times we will do some education for acute care staff or long-term care staff as a well-being and ensuring everyone has the appropriate education, but we don't actually go into the hospitals and do work.
Okay, thank you.
All right. Any other comments, questions? If not, thank you. Very
Well,
much
thank you so much
appreciate
for
you
having
coming.
us.
Very educational, so, and now that it's on podcast or YouTube or wherever we happen to be, people can come in and learn more about PCNs and what they mean in our community, so.
Perfect. Well,
Appreciate
thank you
your
so
coming
much.
in. Certainly has helped us in our understanding, so,
Well, have a good day, everyone.
thank you. So we're gonna take a 10-minute break. Let everybody refresh their coffees, so we're It's 9:47. We'll call the meeting back to order. And before we go back to our discussion on the water system, we need a motion to accept the presentation on the PCN for information. Someone care to make that motion? Councillor Penner.
So moved.
Okay, so Councillor Penner moved that the Committee of the Whole recommends the council to receive for information the Big Country Primary Care Network presentation. All those in favor? And with our thanks, that was good information. So, Mr. Gannon, I assume that was probably you that did that for us, and so thank you. Appreciate that. All right, so we're going to go back to the Three Hills Water East, and we're going to lift that item from where we tabled it. And Mr. McKernan, if you want to continue with your presentation, please.
All right, thank you very much. So our next slide after that last one is just a continuation of some of the costs for the water system, for the full flow and the standalone. So the core operating costs, these are all based off that high level engineering that we did. So these, like I said, they came back with some of these costs for us, so this is what it's based off. So that's just kind of what it goes down. Again, we have that annual average household annual water bill based on our current rates. And again, it shows what basically we're subsidizing per year if we were to construct either the full flow system or the standalone bulk fill station. And then the next slide is just basically a questions. So, just a question slide. So like I said, that was a short presentation that we would present. And then after that, then we would be around for discussions and questions and that sort of thing.
So could you just, for me, in that last slide on the operating costs per user annual is $43,895. So that's just the total estimated annual cost divided by the 85 users. So you have
Yeah, I would say so, yes, yeah.
Okay.
That also includes the interest on the debt and that sort of thing, the principal payment and all that. So it's not just pure operating costs, but financial costs as well included in it.
Yeah, so we have our core operating costs, our loss of interest revenue, principal repayment, interest, that's all in that.
Mm-hmm.
Okay. Any questions? Councillor Cunningham.
I think we spoke about this at the last meeting. We had this on, and we talked about that people would have the ability to take that 20,000 cost over a certain amount of years. Is that correct?
We currently have that in place, so I would imagine that would continue, where if people were to hook up to our existing water lines, they could take that cost and put it over a 5-year payment plan.
Councillor Penner?
Just further to that, I think we have to offer that, otherwise there'll be a lot that will say no for sure, they can't afford it, so we definitely should be offering that option.
So did we have a suggested date, or is that, we're basically trying to determine that?
That would be a determination I think we'd look at today, yeah.
Councillor Forbes?
For the date, I don't want it to go past the end of March because people are going to start getting ready to do seeding, and then we're stuck to the fall this time of the year again, and it just keeps getting postponed. So I would like to see it before the end of March for sure.
Okay, thank you for that. Yes. Mike,
Just
Mr.
regarding the
Zier.
dates, we were planning a couple options just to see what council, what works best for council. We were thinking Tuesdays, if it could follow after a council meeting, if that worked better for council. As well, now with the information about the Orkney Hall, we might have to just confirm the dates on that. So we don't have to bring it back to a council meeting, we just kind of confer with CAO Hogan and confirm dates on that, so
So are you thinking evening?
definitely, yes. And council did agree to a one meeting last time. It was a single meeting we were going to hold.
Okay, so lots of notice will be required so that people can put it on their calendars. Councillor Forbes.
Will this also be advertised in the paper? I mean, I did see on social media our website, but will it be advertised in the paper?
Yeah, we have our little section in the newspaper. We can definitely put it in as well.
And the letters are going out, right?
Yeah, once we figure out a date and time and all that location, then we'll send out those letters, yeah.
Yeah. Okay. Councillor Cunningham.
So I think I saw somewhere you want those back by the end of January, is that right? Was that, did I see that or did I? You did. I did, okay.
That can all be determined.
Okay.
They're just drafts. It's just a draft letter, so we just wanted to get some dates, and if we got dates, then we can populate that into the letter kind of thing.
So I'm just wondering, so when you get those back, how much time do you guys need between that and when the meeting is scheduled? Like a month or a couple weeks or?
There's not a whole lot of information we're really asking back. There's only 3 questions, so I don't see it really being that consuming.
Councillor Penner.
I don't think that date should be too far out, or it'll get lost in the shuffle. I think you give them 2-3 weeks, and then they'll reply immediately, whereas if you give them a month or longer, it'll just get, it'll disappear. So the shorter the better in my books.
Mr. Zier.
Yeah, so just through the chair, our intention with this meeting is to have, maybe Carolyn, if you can scroll through to the section there where it shows the survey questions. Our intention is to actually have a table at the front where we have this survey laid out. People can fill it out. What we're really looking for here is names, locations, the rural address, and then the answers to these questions. We have a mail-out list of, boy, I guess there's a lot of duplicate properties, but around 500 properties in this area right now. Like I say, lots of them are duplicate, but we are expecting an answer from the majority of folks there, if they're in favor of it or against it. We are going to have this on our website as well as a digital survey, and people, like I say, can mail it in, they can fax it in, whatever they feel comfortable with. But we are looking for an answer from basically everybody in that area through this meeting.
Councillor Penner.
I know it is on our literature here but I just wanted to make sure that everybody knows that this is going to residents as well as landowners that don't have residents on there yet. So this letter will be sent to every landowner in that area.
Okay, so it sounds like there's 3 opportunities to do the survey: online, at the meeting, or in response to this letter that goes out if they're unable to attend the meeting. Correct?
Yeah, online is through that letter, though. There'll be a QR
Yeah.
code on that letter. Yeah.
Any other questions? Reeve Whitstock.
Just a comment, because there's gonna be close to 500 separate parcels, someplace on here we should, do you have a residence, so that they don't get mixed up in a bundle and all of a sudden become, yeah, we want it, but we don't live there, and the people that actually do live there, if they don't come up with enough response, positive response to it, it won't happen. But somehow we've got to figure out a way to segregate the ones without the residences as opposed to the ones with. And I don't know. I guess one of the questions could be, do you have a home in this area or something?
But by asking for their rural address, are we not separating residences and just land locations?
Well, that would depend on how they answered that.
Yeah.
If they didn't fill out, I guess if they only filled out the location, like the actual legal land, then you'd know it's a bare land. But if they maybe put in their blue sign, then you'd know they have a residence, I guess, but you don't know people are gonna,
Yeah.
how they're gonna fill it out in the end, I guess.
Okay.
I don't know, it was just a comment. I thought it'd be easier to sort through, would be easier to sort through the paperwork if you knew that they were an actual resident or if they were just a landowner. But you guys are the experts on surveys, so.
Okay, Counselor Forbes.
So right beside the rural address, could you put a little box that says, is this a residence? Then you would know.
Well, you only get
a blue sign if you are a resident, right? So,
and if you remember it.
Counselor Christie.
On the question two, do we want to add a possible water service area tax? Because that's going to hit the landowners that are not getting a connection fee.
I guess we have to be somewhat asking enough questions that we get the information we want, but also not making, again, this survey 14 pages long, which they then won't respond to. So I think the intent of the survey was to keep it simple, and then with the meeting and everything else, we sort of gauge the feedback.
I think the intent of it was to get that commitment, right? To show that people are gonna willing to show up and do the things that we go to the next level, which is engineering. Once we get that engineering, we can do another follow-up, some kind of communication where we can hammer down what the actual cost will be. We can hammer down what, if the water service tax, right? Things like that we can, but I think right now, initially, I think we're looking to get that commitment from people to go forward. We can say that it's gonna be $20,000 or 10%. I mean, 20,000 is a good estimate based off what we have, but that could change, right? So I think right now, I think if we say, hey, council's comfortable with $20,000, asking people to put that as a commitment, we go out there and say, hey, it's gonna cost you $20,000, are you committed? And if we get that, then we go on to the next level where that'll produce, I think, more of these answers that we're asking about, and we can maybe communicate that a little bit more when we actually have definitive numbers.
And I think part of that is clearly communicating the fact that this is what we think it's going to be, but we also acknowledge the fact that once we have that in-depth engineering, that cost could be higher than what the $20,000 is.
Yeah, and I think we have that in the letter, and I think also on the slides as well, to communicate that this is still high level, still not a definitive.
Published number sticks in my head though, right?
I know, and that's the tough part though, because
you know, you say that 10% number, and then I remember, oh, yeah, but you said 20,000, right? And
Yeah.
so it's clearly communication of what the intent is, and I think that's going to be critical for us to be successful or not going forward. So.
And I think that was one of the things, and I don't know if we're gonna change that opinion, but when we first sent out that survey, we didn't have a number.
Yeah.
So people were like, I'm not gonna commit to nothing because I have got no number.
Yeah.
And we still don't really have a number, so that 20,000 is kind of our number we're holding on.
Yeah.
And then anything else around is, I mean, we don't have that info.
Yeah, and I think it's just, in my mind, it's just it's a matter of communicating that we're gauging your acceptance based on this number, but when we do that drill down and we actually get the solid engineering, to be aware that that number could change and likely will, depending on the cost of the project. Councilor Christie.
That's my concern is that we're saying $20,000 connection fee, and we said $20,000, and then we're gonna come back in with a water service area tax. Then they're gonna say, but you said 20,000 and no other cost. So, I mean, that's my concern here.
Okay, Mr. Hogan.
Through Mr. Chair, I think one of the things we can do to address that, one is I don't want to use just to put out there, I know we've used in conversation, the term water area tax, is we've moved away from that term. But I think we can amend question 2 possibly to say, you know, a possible potable water system requires a $20,000 connection fee in addition to monthly utility rates and a possible improvement levy. As Mr. McKiernan said, we don't know what those numbers are yet, and we can't know them until the project goes forward and council figures out a funding philosophy and where we're going to take from where. But we can make reference to the fact that there will be additional charges on that 20,000 within that question without having to nail down what they are.
That would answer my question, but my concern is the landowners that don't have a residence, just have a quarter, all of a sudden may end up with a levy, and they're gonna say, what the hell, how'd that happen?
Yeah, so I think we can make reference to that, you know, that if we just said something along the lines, and we can wordsmith it outside of the meeting ourselves, but it requires a $20,000 connection fee in addition to monthly utility fees and a potential improvement levy on all properties in the area. We can put some wording to that, and then whatever that looks like, because if it doesn't commit us to doing an improvement levy either, but it does put it out there that it's a distinct possibility. And that would be consistent with what you've done in other areas in the past.
Okay. So, yeah, Councillor Penner, no?
I'm just moving forward. So, how long would you guys need, or administration need to get the wording up and get this letter sent out? Or when would you like to send this letter out, put it that way?
Well, I think when we pick a date, then we would probably send it out, you know, enough time to give people time to put it in their calendars, set it out. I don't know, I know if I got a letter a month out, I would be knowing what's happening in a month kind of thing, so I don't know. Anything's open, depending on when we pick that date, we'll determine when we send this letter and stuff out.
Mr. Hogan.
Yeah, through Mr. to pick up on what Mr. McKiernan said, I think that's what we would take that lead from. If council determined that you wanted to move forward with this in, we've heard prior to March, if that was a January or February, I think that's part of the motion that we'd look at coming out of this, is that Committee of the Whole recommend council move forward with a town hall regarding the proposed Three Hills East water system in January or in February, or to that. As long as we know that, I think we can hone in on a specific date where hall's available, and with the intent that would either of those would leave us with enough time to send the letter out a month in advance, or would give us that time frame.
Okay, so we're in a committee of whole, so we're going to make a recommendation to council to go ahead with a public engagement regarding the Three Hills East water. Are we at that point where we're prepared to do that? We have enough information. We've asked all our questions. Okay, so would somebody care to make that motion to recommend to council to direct administration to go forward with a Three Hills East water resident engagement? Councillor Penner.
I'd make that motion. Do you want to hear a date in the motion too, or just? Okay, I say February, sometime in February. We can have more discussion over this, and held in a rural hall, one of our rural halls.
Okay. Just hang on a second, Councillor Cunningham, I'll come right to you. Okay. You just want to comment, or?
I'm just looking at the calendar, and if we are sticking to a Tuesday, it looks like
Valentine's Day.
Well, I was gonna say, I know all you men have a lot of plans for your beloveds, so we'd have to, not do that. So the 28th would be our two choices in February.
So the 28th.
To run with the 28th.
Are we good? So we're going to give them enough flexibility to check with the hall and find the date. So we know it's no later than the 28th of February. So, Councillor Penner, are you good with that motion, since you're making it? I think we understand the intent, that we want a town hall, we want it in February, and we want it in a rural community hall. Okay, so that's Councillor Penner made that motion to recommend to council to move forward with the Three Hills Water East Engagement Town Hall in the month of February in the year of 2023. Just to take away what possible year you could choose. All right, we understand the intent. We know where we're going with this. Are we ready to vote? Okay, all those in favor? And that's carried unanimously. Thank you. Thank you, Mr. McKernan. We appreciate your presentation and your help, so thank you. All right, now we are moving on to item 5.0, which is the Kneehill County Scholarship Program Review. And Mr. Hogan, are you taking this one, or Ms. Vanderquill?
I'll take this one.
Okay, Carolyn, whenever you're ready.
Perfect. So we have in front of you the amended scholarship policy that we discussed at the last committee of the whole. We took your recommendations and made the changes to the policy. So the recommended changes that we heard from you were to remove that a high school diploma is required for eligibility, and applicants need to be enrolled in their first year as a full-time student at a post-secondary institution and be a rural resident of Kneehill County. The scholarship application due date changed to June 30th, but checks are not dispersed until confirmation of enrollment when they attend in September. This change will allow applicants to know if they have a scholarship before they are attending school. And the criteria for selection be amended by removing the academic achievement and the new criteria being 50% written essay, 25% letter of reference, and 25% contributions to school or community leadership activities and personal achievements. And we have for you the policy, and we just want to know if you are, if you want any further changes or amendments before we bring it to council. And
Okay.
the last page, I also created a poster that we can send to all the schools. We're hoping to change the picture of the girl to maybe be a rural student of Kneehill County, maybe the last scholarship winner. Does it? Oh, perfect.
You already scanned it? Okay, good. So, questions, comments, clarification? Councillor McGee.
I just wanted to officially say that I appreciate that you're changing the picture out. I think it's critical that we use our own people. It makes it more personal and recognizable as achievable in this area as well. So just so that's well understood, I think it should be a requirement of the poster.
Okay, any other comments? Does the policy reflect our conversation previous? Sounds like everybody says yes. Okay. Councillor McGee.
I'd like to recommend that we recommend to council, I'd like to make the motion that we recommend to council, let's get the right vocabulary in the right order, that we approve the amended policy.
Okay. So Councillor McGee has moved that the Committee of the Whole recommends the council to direct administration to bring back the amended Kneehill County Scholarship Policy as presented today. Are we prepared to vote on that motion? Any further Councillor Cunningham?
I just want to make a quick comment. I want to thank my fellow councillors for their openness and willingness to examine this policy, and just want to thank Lisa Dow again for bringing this forward and for her wonderful presentation that she did back in September.
Okay, thank you. Councillor Penner.
I'll be voting against this today. I want to thank Lisa for coming forward, and I encourage more residents to come forward. I sat on parent council for a long time, and funding was a big issue, and I like to support locally, provincially, within our province for this stuff, and I voiced my opinion at a previous meeting too in regards to this, so that's why I am going against it, but I thank Lisa for coming forward and presenting to us.
Okay, thank you. Any other comment, questions? So Councillor McGee, there's your motion in front of you. Are you okay with that? All right, are there?
Yes, I am.
Last chance. Any further comment or questions related to the motion that's in front of us? I'm not seeing any, so I'm going to ask the question. All those in favor? Opposed? The motion is carried. Thank you. So the only other item that's on our agenda is a closed session item. It's 6.1, advice from officials, section 24 under FOIP. So could I have a motion to go into closed session? Councillor Cunningham.
So moved.
Okay, so Councillor Cunningham has moved that council go into closed session at 10. So the motion to come out of closed session and return to open meeting was made by Councillor Forbes at 11:38 a.m. We recessed. It's now 11:40 a.m. Meeting is resumed. So there are no motions coming out of closed session. And so that's the end of our agenda. And we are going to adjourn at 11:41.